points are very clear for needling. So see it, because when you have a good atlas of acupuncture and anatomical acupuncture points location, then you can do very good and very good miracle results. So start from first page. I think there are 44 page. Ja. You see, in this book, I told you this book is from Beijing University. So in this book, all the points name in English and Chinese name. There is not point name like UB40, UB30, and LI5 and LI4. Only there is name of Chinese name, but points location and is very clear. How you have to needles. In this picture, you see from back points, most important, all the back shoe point. So when you see in this picture, you see all the points are very near to nerve, spinal nerve, very near to nerves. So all the points are very important, play a very important role to treat anyone, because they are very near to all the organs and very near to spinal cord. So they give a fresh intention to brain and fresh message to brain. In next PPT, you see the face points. All the face points you see very clear with muscles and with the arteries, veins, and everything you can see very clearly. I share full book. This is very nice book. It is my favorite book because I read so many books, but this is very important book because the location and point location is very good in this book. So second next PPT you see about eyes needling and points near to eyes, and you see here the point BL1 and ST1, BL1, all the points are very clearly shown here in next PPT. You see here in all the points are very clear near the nerve area. So I am not teaching you this, but I share this book only on interest. You have to see where is the nerve and where is the point and where is the arteries and veins. So we gave a safe and good treatment to the patient. You see in all the pictures. There are figure number on the each page, and there are page number also. So I collect all the pictures from a book and I share with you. So see all the pictures in this PPT. Next PPT you see. Next. In this, you see how the needles insert. Here is correct position and incorrect position. You can see very easily. On next PPT, back area points. Then next, see the pictures on neck picture. Where is three needles are inserted. You see one needle is very incorrect direction. If you put like this a needle on this area, then it can be directly the person is become mad and immediately died because it hit directly on the cerebellum area. So it is very dangerous. If you are putting needles on this area, then above two needles are very fine and familiar, but incorrect direction here is given. So I share only with this interest to tell you. On next PPT, you see chest area. Now you see where is going GB20 needle direction. Then go to next. Only you see the needles and directions. On this front, on stomach area, you see all the points. Front mu point and stomach meridian and kidney meridian points. You see the CV meridian point. All the points are very near to veins and nerves. So distant. Do you have any question? Then next PPT you see. Here you see all the direction of needles on the chest area, all the important points. How the needles going through muscles and which muscle is initiating in this moment and which is involved in this needling method and how it is safe and how it is dangerous for you. So next, spleen meridian point. You see all the muscles. Here is no any vein, not any arteries, not any nerve. All the 3 points have nothing. So it is safe. On next PPT. Here you see all the points very near to muscles and very near to spinal cord, and all the points are described very clearly. Those points are near to shoulder and hip. You see how the fascia is contracted with each others and how the muscles is relationship with the points and the body points and muscles. And you see next PPT. Yes, the most important the thing is this: how you needle on lumbar area, all the needle direction which you have. Are you clear with all the pictures, or I send full book?
We are clear. I'm clear.
Okay. I send full book. Don't worry about anything.
Okay, thank you.
Because I am a thief, but I am giving to others. If I gave you if I gave you the same book, then you see and you watch only once. Oh, this book, but you don't collect all the pictures on one very short book. This book have I think 269 pages.
Whoa, that's a lot.
And I compress it in only 34 pages. Because you are very familiar with the acupuncture point location and all things. There are so many books, but in this book, all the picture is very nice and very good. You see, so in this picture, you see how long we have to needle in lumbar area and which muscle is involved. Here you see, I send you the book. Then you see on the body there is 3 section. On the body, dummy body, you see there are 3 linings, and all the 3 areas are here given. How to you needle and which muscle is there present. And next, now you see hands and back. First you see back muscles and needling method. You see in this picture when the needle is inserted near the thoracic and lungs area, it is transverse. almost. I am showing you this beautiful PPT because I made it for you anyhow learn or anyhow you listen from other persons about catgut. Do you know about catgut?
Yes, catgut, right?
Yeah, yeah.
That's for
Prepare this
curing.
PPT for catgut.
Okay.
Yeah, because there are very good results with the catgut therapy in paralysis and in pain management and in back pain management. Uh, there is miracles result with catgut, but people still are doing only with the asthma. In India, there are so many people; those are working only for asthma, bronchitis, and all. But they are not doing for back pain and obesity and paralysis management and the bone deformities and for CP child. They are not using, but I prepare all the PPT for that purpose. I share with you because I want to give everything. I am not now which day is my last day and which day is my first day, because we have to go miles to go before I sleep. So I share all the things with you all. Next, you see this picture. All the points are here presented. But you see, where is the veins and nerve? Everything is very clear in this picture. So all the picture are same like this. Next PPT, Dr. Anita. You see there is sections. Next PPT. Ja. You see here, all the points are in one line, only on nerve. When you are do neuroacupuncture, I teach you neuroacupuncture, then these pictures are very important. If you are going with the tongue acupuncture, these pictures are also very important because you have to save always arteries, veins, and nerves. So all the picture are very good for all type of acupuncture. Then next PPT, Dr. Anita. In this you see how we cut a section and show the needling direction where it is going. The last you see PC6 and TW6 threading needles technique. In this picture you can see. And then you see near the wrist how you have to insert the needle, because insert needling is very important in acupuncture. Next PPT. Next. Next. gone foot. Next. Wait. In this picture, you see all the good points near elbow, LI5, LI11, LU5, LI11, that's a 9, 10. All the point are here. Then threading technique for SI3 to LI4. LI4 to SI3 for neck pain and shoulder pain. Next. Next. Sorry, back. Previous. Yes. Why is important hand acupuncture and reflexology and sujok? Why they are important? You see here, there are so many fascias and so many theses, and all the nerves and these points on hands and foots. So it is very important because when we treat fascia, it can treat all the body. Next PPT. Now you from here to next. Next. Here is SI6 ST36 point. So next. Yes, see in this picture all the needling methods about ST36, GB34, SB6, kidney 3, and all points. So this is important for only for this purpose. I think people are still joining. So I request you all, please read this PDF very carefully and very with very interest, because it is the base of your practice for a good clinic practice. Dr. Anita, please
Yes,
share please share Yamamoto.
Okay, sir.
Yeah. Because it is 10 o'clock in Indian time, and in your time 5:30. If you want to purchase the hard copy of this book, it is I think it is very costly. So I provide you PDF copy. Then you got printed. There is no problem. That also a hard copy. I have so many books. Those are in Indian currency 10,000, 11,000, 15,000 and more. Then there is no need. In Indian currency, I prepare all the books with the printer, PDF books with printer, only in 200, 300. But actual cost is 10,000. And what is the purpose? We have to read, and we have to learn. So why you are spend so much money on purchasing hard copy? You see, here is only 34 pictures. Those are colorful. And you go to print to buy this book, and it is then 10,000. So I suggest you all print only that pages which you are need more. Yeah, Dr. Anita, please share Yamamoto. Toshika Yamamoto. We start with scalp acupuncture.
From this page,
From first,
pardon,
from first page,
from first page.
YNSA.
Okay. So, is this the first page you're asking for? This is the very first page on the PPT.
Yes, yes.
Okay, thank you, sir.
950 920 3317. Oh, no. Yes, Dr. Anita. Please share PPT.
It's shared, sir.
No, it is Atlas book. I am asking about YNSA Acharya PDF. You find it or not find it? Today I send you.
Prof?
Yeah, I send you today.
Okay.
See in your book. I send you book.
You
Yes,
send me book.
today.
It's on this.
YNSA Acharya PDF.
Okay, I should share the PDF, not the
Yeah.
PPT. This is the PPT on the screen. It's
Oh,
sent.
you want to run PPT, then PPT. If you want to run PDF, then PDF. No problem.
Yes, I'm sharing the PPT now.
Both are same.
Both are
But
simple.
yeah. So share, please share PPT.
Okay, it's on the screen. So are you seeing it?
No, I still I am see old PPT, Atlas PPT.
Okay.
I've been shouting your name since. Where did you go? Not mine. Not true. Now we are close. Let's go out. Be fast. I'm going now. I pray that I meet these people.
Prof, are you seeing it now?
Yes.
Okay. Okay, sir.
Yeah. So we start with the Yamamoto new scalp acupuncture. I hope you all are ready to learn these beautiful scalp acupuncture techniques. So what is the Toshika Yamamoto sage? If you don't give up it, the libre, the paralysis and the pain will heal. On next PPT. Next PPT. Sure. In modern system of scalp acupuncture in China,
Come and see.
previous PPT, please, Dr. Anita. Previous. Yes. The modern system of scalp acupuncture in China has been explored and developed since the 1950s. Various famous physicians introduced Western neurophysiology into the field of acupuncture and explored correlations between the brain and human body. As the understanding of neuroscience developed, so did scalp acupuncture develop. Jason Howe. Jason Howe is the famous neuroacupuncturist, and they are taking so much high fees. I told you for only basic, they are taking $1,500, 3 days class. Now you see next PPT. In this picture, there are so many techniques of scalp acupuncture. It is combination of all type of acupuncture. So please next. In this you see the first above picture, Dr. Jo Sunfa. Dr. Jo Sunfa is pioneer and main investigator of scalp acupuncture. They are pioneer in this field. After that, Professor Zhuming, Professor Feng, and Professor Jingming Chu, and Professor Ten Cheng. After it, the Professor Toshika Yamamoto comes. Chinese scalp acupuncture and neuroscalp acupuncture. Next PPT. In this PPT, you see on first in this picture you see Josunfa. There are linings. Then on the second, Professor Juming gave the areas. Then Professor Feng gave the human body presentation on scalp. Then Professor Tengshan also gave the bodies backward and forward on the scalp. Next PPT, Dr. Anita, please. Chinese scalp acupuncture and neuroacupuncture. You see in these pictures, there is brain, and on second image, there is brain with parts, somatosensory cortex, primary motor cortex, angular gyrus, primary visual cortex, Warnke's areas, primary auditory areas, and Broca's area. So what is this? During the 1917, scalp acupuncture was developed as a complete acupuncture system. The two major contributions to its development were Dr. Gio Sunfa and Professor Juming. The therapeutic zone of scalp acupuncture corresponds to motor and sensory area of the cerebellum area, cortex. Because our body have two type of sensory moments. Two type of moment. One is sensory and one is motor moment. Our work is brain is working in two senses. One is sensory and one is motor. When our brain get sense, then he work motor work. Suppose that you see something that you are not like, or you see there is a lion, you immediately run fast, very fast, very fast, because you have a fear. He ate me. So When
I want to
your
understand this.
eyes gave the direction to your brain, there is a
Yeah.
line, then you start running. In this process, there is your eyes got sensory working and your brain do motor movement, sensory movement and motor movement. So the example, DU20 and UB9, both are on motor area. Body and central nerve system, body is yin and yang, the central nerve system is yang. YNSA is based on the general principle of scalp acupuncture. Next PPT. Dr. Anita, please next PPT.
Yeah. Are you in a meeting?
Previous.
If not, please help me with.
Yes.
Help
This
me with that
picture,
vaccine or that
in this
castor oil.
picture, you see Dr. Toshika Yamamoto, who is the discovery of YNSA.
That
Yamamoto,
castor oil.
new scalp acupuncture. Japanese anesthesiologist who specialize in the pain management. About in this PPT, you see, you read all the things about Toshika Yamamoto. Next PPT. Next. In our body, there are two types of our body, yin and yang. This rule in every acupuncture field. If you go in TCM, there is yin yang. If you're going in balance method, there is also yin yang. You go in scalp acupuncture, there is also yin yang. So when these points are used, I will tell you later because it is advanced level part. So first we do basic, then we do next class we do advanced. So next PPT. What is YNSA? YNSA is a microsystem of acupuncture. YNSA is a microsystem of acupuncture such as auricular therapy and hand acupuncture, Sujok acupuncture. The scalp reflects all the body imbalances. Needling specific scalp point can restore body balance. Because you see a spider, if there is any imbalance, he immediately go there and treat that part and balance the house. So in needling a scalp acupuncture, next PPT. Needling a scalp acupuncture point can elicit a sequence of response which can potentially change the patient's energy flow. What is needling doing? When we are inserting a needle, it is very elect a sequence of very responsibility and very fast, and it gave patients energy flow. Palpitation of diagnosed zone of YNSA can suppress the appearance of a sequence of negative response. Next PPT. Benefits of YNSA. What is the benefit of YNSA? YNSA can be combined with manual based treatment YNSA can be combined with TCM. YNSA can be used to correct body imbalance. YNSA benefits patients with a neurological disorder because it directly and rapidly influences the central and peripheral nerve system. YNSA can be applied during all stages of pregnancy. YNSA improves systems, and this improvements is immediate. YNSA builds the therapeutic's confidence because the patient's response is very rapid. And YNSA can be done anywhere, anytime, does not require special equipment or faculties and facilities. Next PPT. Comparison between scalp acupuncture and YNSA. Here is comparison between two scalp acupunctures. Scalp acupuncture have therapeutic zone, but YNSA have therapeutic points. Scalp acupuncture correspond to the motor and sensory area of the cerebral cortex only. And YNSA is microsystem. In scalp acupuncture, needle threadings and manipulations. In scalp acupuncture, what we do, we insert length needle till 40 mm on threading technique, and then we manipulate. But in YNSA, there is no need of manipulation after needling. Blind application. Scalp acupuncture is blind application because there is no zone of any diagnose. And needling zone are determined by the symptoms, only on symptoms. But in YNSA, there is diagnostic area. In this YNSA, there is diagnostic areas, so it is not blind. Next PPT. Contraindications. What is the contraindications of YNSA? Body temperature more than 102 Fahrenheit. Fatigue and yin deficiency. Next PPT. The needling depth in the YNSA. The needling point on the scalp are located on the loose connective tissues below the subcutaneous tissue of the scalp skin. After looking for bump and sensitive area in YNSA, what we do, we find out a very sensitive area. When we find out a sensitive area, then we insert needle and get results immediately. Next PPT. Mode of operations of YNSA. Although it is not recommended that an acupuncture needle should be inserted at an angle of 15 degrees, the direction and the angle of the incision is not clinically important. In this method, you have only put the needle only on painful areas. The direction is going anterior to posterior, posterior to anterior, it is doesn't matter. You should have to reach on the sensitive point. The duration of YNSA is at least 30 minutes and the patient can be sent home after insertion of the intradermic needles, depending on the effect you wish to achieve and sensitivity of patient conditions. The acupuncture needles which we are recommended and used by Toshika Yamamoto, 25 into 40 mm acupuncture needles, but I use only 25 into 13 into 25 needles. I always use those needles. For other scalp acupuncture, I use 40, 25, 40. Next PPT. Basic points. Now we have to come on points area. There are these 8 basic points. Start from A, B, C, D, E, F, G, H, I. It is located on yin and yang. It is clear to all you. And next PPT. A point. A point. Location. Approximately 1 centimeter lateral to the sagittal line of the face. 1 centimeter lateral to the sagittal line of the face. And 2 centimeter vertical line that start from 1 centimeter above the hairline to 1 centimeter below the hairline. Indications for neck problem, cervical vertebra 1 to 7. When you have problem with neck problem, cervical problem, there is pain in hands, because most of pain in hands occur due to nerve compression of C5, C6 and C7. Sometimes there is vertigo. All the problem are because of cervical vertebrae. So it is very important point of A point on both sides, 1 centimeter lateral, 2 centimeter long, 1 centimeter from above from hairline and 1 centimeter below from hairline. Then it can treat cranial problems, pain in teeth, pain, migraine, and memory loss, schizophrenia, all the brain problems you can treat with this point. When you treat any problem of brain, you should use point A. Then for ear problem, eyes problem, swelling in throat. Next PPT. In this PPT, you find it, I think, very clearly. Where is A point? I think you got it very clear. You can put needle from top to bottom and bottom to top. Are you understand with point A? Please tell me. You all are understand with point A, work, indications, location, and needling method. Or I have to show you the needling technique inserting by myself. If you need, I will do.
Hello, doctors. I hope we are following.
Yes.
Yes, doctor. Yes.
Yes, ma'am.
Okay, he's asking if we know where point A is on the scalp. If we don't know, he can show us where point A is on the scalp.
Yeah.
It can show you.
In this picture, I think all the picture is very clear.
Yes, the pictures are clear.
Yeah.
The picture are very.
If you want, I put needle on my scalp and show you how to insert the needles. Then I will do this. No problem.
You can show us.
Kindly do that, sir. We appreciate.
We appreciate
Okay.
it.
Okay, I show you on in one session all the needles in one shoot. Okay.
Okay, sir.
Then next point, next PPT. B point. In my this PPT, which point is telling that color is black. In this, you see there is 2 black dot on forehead in this picture. This is the point location. How much far from center line? 2 centimeter lateral to the sagittal line. The point is on the natural hairline. If you find a hairline on my scalp, then how you can find? Because I have no hairline. So when you put your forefinger on your forehead above the start from nose. Yeah. You see me? When you put your forefinger on your forehead, then it is your hairline. Forefinger above. So it is 2 centimeter lateral. Then problem and indications. Problem and pain of the neck, shoulder pain, upper shoulder pain, and shoulder blade pain, sore throat, problem with thyroid gland. Connect with point A to C. Suppose that you have shoulder pain, then you should use point A, B, and C. If you have a hand problem, then you use point A, B, and C. If you use all the 3 points, then fully area is covered. Next PPT. In this picture, you see it is very clearly from mid sagittal line to 1 centimeter A, then B. Next PPT. C point. C point. Where is it is located? The outer canthus of the eyes, the line beginning 1 centimeter above the hairline and continues 1 centimeter below the hairline at an approximate 45 degree. Can you see me?
C point, madam.
Yeah.
Okay.
Then put one finger here and go directly above. Yeah. From like this, one finger here, then go directly above. It is point C. From hairline, 1 centimeter back and 1 centimeter forward. 2
Okay,
centimeter.
From
When you have problem with elbow, then do pinpoint on hairline. If you have problem in shoulder, then go back. If you have problem in hand and wrist and lower arm, then you should go forward toward the face. Are you understand with me with this point? Yeah. When you go for shoulder treatment, then from 1 centimeter from hairline to above, posterior, anterior to posterior needling. When you are using for elbow and wrist pain, then go forward towards the forehead. There are two methods. I will share some picture also you on group. In group, you can find it very easily. And the second thing, when you make a 45-degree angle above the ear from sagittal line, then it is directly go on C point. And another one thing, next PPT you see, ja. It start with coronal suture. It start with coronal suture. So when we read about Feng, then I will tell you the importance of the all the sutures, how they are working and how the needles work on their side. So next PPT. D point. Where is D point? It is very easy to find out D point. Put a specs on patient's eye, then needle on the wire. From hairline, you see this point location. It is directly go from anterior to posterior needle or posterior to anterior, no problem. But it is very important point because it treat all the lower body problems. Problem of diaphragm and below the orthopedic and neurological problems, problem of hip, leg, and low back, gynec problems, kidney and bladder problems. It is very important point. Whenever you use for it for knee pain, it have very miracles result. There are 2 points, only 1 point. Dotted 1 point is D point on yin and yang both sides. You see. So it is very important. Its location you find, or I will tell you. In next PPT, you find it very easily. Ja. Now you see, from hairline to top of the ear base, top of ear base to eyes canthus corner, eyes canthus corner. Then you draw a line. On that line, this point on hairline. When you find another point, I will tell you what is the work of that point. Next PPT. It is next point D1. D and D1. D1 is used for all type of lumbar problems. You see D1 to D5 on these images. D1 to D5. When there is a problem in disc problem, disc herniation and all type of problems, then you put one needle from top to bottom and bottom to top. No problem. There is no dangers. It is very safe. Only subcontinuous needles. Are you understand with this point? D and D1 both are used together. D and D1 used together, and very miracles result they have. Next point, next PPT. E point. The E point is located on our superciliary ridge muscles, superciliary muscles, and it is oblique 2 centimeter long line. Start from 1 centimeter lateral to above the eyebrow. It is in this area when you needling, then it treat all the thoracic areas problem like cardiovascular problem, breathing difficulty, respiratory conditions, condition of liver, stomach and diaphragm. Because this area represent T1 to T12. On this picture you see there is written T1 E1 to E12. It means it is working for nerve areas of T1 to T12. On A point there is written A1 to A8 and C1 to C8. Then D1 is also written D1 to D5 lumbar area. So today we do A point, B point, C point and D point and E point. Now you see, someone have chest problem, feeding problem, and pneumonia, heart failure problems, then you use this point. Sometimes in my clinical practice, I see when we treat shoulder and back pain, upper back pain, we put needle on A point for cervical region, then put B point for shoulder pain, then we put C for shoulder pain, but there is no cure. And after insert a needle on E point, immediately relief, because it starts from thoracic region. And you see, when there is a problem in thoracic region, the muscles of trapezius, the biggest muscle of back and neck areas, trapezius, that muscle is involved in till T7. So it is very important point. Next PPT. In this picture, you can see very easily which muscle is involved and which muscle is on where it is located. Next PPT. F point. Oh. At the highest point of the mastoid bone, when you put a finger back of ear, then you feel there some tender point and painful point. Needle on that point, immediately the pain of sciatic pain immediately gone. Piriformis syndromes and piriformis muscles pain immediately gone. It is very fantastic point for sciatic and piriformis syndrome. You use D point for sciatic pain, but there is no relief. Use F point also. There is immediately results. Then next point, PPT. In this picture, you can see very easily where is the D point. D1 to D5 and then F point. It is clear. Next PPT. G point. G point is very good point, but there is two G point in yin area and yang area. So always there are 3 points because lateral, middle and back. There are 3 parts of a knee and it is very good point for knee pain. It is very near to point D on yin side. In chronic knee pain problem, use F and G point. Back of ear, there are 3 points. Use that point. And in yin problem, for acute problem, use D and G. When you draw a line from eyebrow corner to ear base, top of ear base, then on this line, this is point G on hairline, and it is a very good point for knee pain. It work like a miracle and like a magic. Someone asked me in group on my personal chat. I have not remember the name. Then I told today I will tell you about knee pain. About knee pain. So I am telling you now the protocol of knee pain in scalp acupuncture. You use D and G and F and D1 to D5. 1, 2, 3, 4 needles. Knee pain is gone. But how we have to use, on which side we have to use, I tell you tomorrow.
Monday.
Ja. Because today I am telling you only points G. Then next PPT. In this PPT, you can see very clearly where is the point location and where it is established. On next PPT, H point. H point is approximately 1 centimeter above the B point. And it is used for lower back problem. Very effective for knee problem and back problem. All the lower limb area problem. It is important point. And use with D and G and F and D1. Next PPT. There is one another point I, that is above 1 centimeter from C point. That also used for lower limb problems. So tomorrow next PPT, the brain zone, location and indications. We do it today or tomorrow. The brain zone, location and indications. Then next PPT. Function of brain, perceive, interrupt and respond. I tell you in fast. When you see any object and you like that, then you want to get. When you see, that is sensory moment to your brain. When you have a desire to get, that is the processing. And when you work for that, that is respond. Next PPT. CEO. In every company, there is a CEO. That is cerebrum. Cerebrum is largest part of our brain. largest part of our brain. Then coccio, that is cerebellum. It is called small brain. And then manager and workers, brainstem, spinal cord, and peripheral nervous system. Next, cerebral zone. Cerebral zone is you see 2 centimeter vertical line which begins 1 centimeter above the hairline adjacent to point A. Where our point A is end, then cerebral zone is started.
Yeah.
And 1 centimeter lateral to the midline. Indications: all acute and chronic neurological problems, short and long term motor problems for paralyzed patient, and movement disorders, psychiatric disorder, attention deficient disorder, attention difficult hyperactive disorder, ADHD, attention deficit hyperactivity disorder, ADHD, sleep and memory disorder, and hormonal disorder. This point is used, you see in red color in this picture. Needle direction anterior to posterior, find painful area and insert needles. And it treat all body, full body pain, because it is cerebral zone. Now next PPT.
Stop doing that. When they're correcting you, take instructions. They're talking, you're still doing like this. Can't you think calmly? Ah.
They are asking some question or they are talking with each other. Dr. Anita.
Prof, you said something?
There is any question?
Okay. He's asking if there are questions.
Then I'm telling about brain zone. Today we finish brain zone because it is too long.
Okay.
If you are tired, then there is no problem. Cerebellar zone, it is the short brain. The main working of this area, first of all, I tell you location. A 2 centimeter vertical line which begins about 3 centimeter above the hairline, and our lies the lower part of the cerebral zone. There is a line, 2 centimeter line, which is covered by 2 centimeter, 1 centimeter it covered to cerebellar area. Then indications, problem of balance. You see after paralysis and after weakness, there is no balance in body. Sabital orientations, coordinations of movement, speech, thought, learning, emotions, hormones, cognitive dominance, attention, language, learning, executive functions, social conjunctions. When a person's this area is disturbed, when there is a problem in cerebellum area, then there is no balance, no learning moment, no other moments in body. Then we use this area for speech management, thought management, emotions management, hormones management. When there is balance, you want to balance your body. You want to balance your body, then you use this point. Anyway, you are angry on your child, then you have to balance your yin and yang. Then put these needles, no problem, because it balance your body and it treat the short brain. Then the basal ganglia zone location between the cerebellum and cerebellum on both sides, 0.5 centimeter from sagittal line. This area is 3 centimeter long line, and it is very useful for Parkinson patient, because our basal ganglia control voluntary movements. When there is a inability to control voluntary movements, we can use this point. Parkinson and other problems, you can use this point. So we stop here. Today we do 40 and remaining 60 we do tomorrow. If you want tomorrow class, then tell me. And if anybody have any question, then ask. And I request you, Dr. Anita, stop the recording.
Okay, Prof.
Because it is very long,
Yes.
1 hour 44 minutes. So I gave 15 minutes to you for ask question